experience. One of my colleague's friend was admitted at Calcutta Medical College with diagnosis of dengue. So his platelet count was found to be 10,000 and he was transfused 6 bottles of platelet probably. But after that it came down to 6,000. Can it happen, or is it an anomaly, or is it a faulty pathology report? No, after 6 units of transfusion it came down to 6,000.
This is a rapid, what you should be irreversible, because this is a rapid. There is 2 types of platelet transfusion. One second order platelet transfusion, another rapid transfusion.
Dr. Malik will highlight.
Dr. Malik will highlight.
Dr. Anwar with some tips for the kit.
Correct.
Good morning everybody. It is a very important
No cross talk.
discussion because every day we are facing. I will take only maximum 5 minutes. Regarding dengue, the most important thing, it is caused by what Dr. Jha has told. It is by the 4 types of viruses, and one virus, when has attacked, there will be formation of IgA followed by IgG. IgG will last long, but if the patient has been attacked by the second time, then what is the problem? Because if we consider the dengue, the majority, what Dr. Jha has told, it is in the bottom, that is asymptomatic. It is just like a pyramid. So what we are seeing in the second phase, that is the symptomatic phase. Third phase, not third phase, third type is the dengue hemorrhagic fever. And fourth is top is dengue shock syndrome. So if the patient has first attacked by the supposed type 1 virus, then their IgG level is high. In the second time, by the type 2 or type 3, then IgM has occurred definitely, but as the patient has IgG, then there is a formation of dengue hemorrhagic fever. So if the one patient is having the IgG plus IgM, then the patient is serious. But if the patient has only IgM, the most probably patient will not go into the dengue hemorrhagic fever or dengue shock syndrome. Dengue shock syndrome is in the topmost and it is a very low percentage. So it is just like a pyramid. That is very important. And when the patient has been suffered from the type, suppose type 1, then there are 2 types of immunity. One is homotypic, another is heterotypic. Homotypic will persist for lifelong. That is suppose type 1. But heterotypic means for the 4 or 5 months, he will be immune to 4 types of virus. That is number 1 point. Number 2 point, what Dr. Jha has told, I will slightly modify. Still, at present, the basic clinical findings, whether patient has fragility of the capillaries, the most important test is tourniquet test. Tourniquet test and tourniquet test. What you will do? You will maintain the blood pressure between systolic and diastolic for 15 minutes. And you will make a circle of 2.5 centimeter diameter. If there will be more than 20 petechiae, then patient has a capillary fragility test is positive and patient may go into the dengue hemorrhagic fever. So bedside clinical test is tourniquet test and tourniquet test. Third important, the patient has not 3 types but 3 phases of fever. First one is typical fever, this rhinorrhea, this headache, this congestion, retroorbital pain, body ache, backache, and so like. Second phase is the leaking phase. Leaking, capillary leak syndrome. Capillary leak syndrome, everything will be leaked to the capillary, and it is due to the endothelial dysfunction, mainly due to the interleukins, mainly due to the cytokines release. And it may so happen that patient may go into the mass, that is the macrophage activation syndrome. Dr. Sharma can that one patient we got the collagen and patient got into the mass. So this time cytokine storm may occur and patient may go into this mass. So there are varieties of presentation. And when the patient has got into the leaking, followed by there will be reabsorption of this fluid, and that is called the congestive phase. And in that particular time there will be bounding pulse. So that is a better phase. And another important thing, the patient, if we cannot manage properly, particularly dengue shock syndrome, by giving fluids, how much fluid you will give? Either maintaining this central venous pressure or by measuring the output, that is the kidney function. It will be approximately more than 1000 cc per day urine output. This guideline is mainly for the clinics. What we are facing, yesterday I have got one patient, patient is having 18,000 count platelet. Patient is having this hemoptysis, patient has downplatelet. So we have to give the platelet. Platelet, what Dr. Patnaik was telling, there are two types of platelet. One is random donor platelet, that is from ABCD-EFGH patient. Another is single donor platelet. So random donor platelet, if you will give, it will maximum for around 36 hours, 48 hours. Again it will fall. But if we give from the single patient, then it will be single donor platelet, and the chances of antibody is less. So that's why it will persist for at least 4 or 5 days. And actually we have to purchase the time for 4 or 5 days. After that, automatically patient will recover. Regarding the dengue hemorrhagic fever, the latest treatment, not only by the platelet, but there is an anecdotal report that you can give the anti-D, that is anti-RHO, what we are giving in case of idiopathic thrombocytopenic particular. Anti-RHO is, you can give, dose is single, 75 milligram per kg of body weight, single dose. There is an anecdotal report, it has come in the book, but how far it is effective, God knows. So either you give the platelet or you give platelet plus anti-RH. Another important thing, for increasing the anemia, to improvement for the anemia, we give the erythropoietin. When there will be WBC count is low, you give the GCSF, that is a granulocyte colony-stimulating factor, or GLCSF. But the latest thing for this platelet, where the patient has a thrombocytopenia, I am not telling in this case, but the thrombocytopenia, again there is a recent report is thrombopoietin receptor agonist that has come into the market, not here, and there are two types. One is eltrombopag and another is lomifloxacin. So these first one is a tablet form and second one is a subcutaneous form. You can give per week. So whether it will come in the later near future, I don't know, but it is usually given in case of HIV patients and HCV, that is hepatitis C virus patients, where there is a more chance of this decrease in the platelet. And another important thing, the patient may come to you later on after 5 or 7 or 8 days with a complications. That complications may be due to central nervous. Patient may come as a stroke, patient may come as a Guillain-Barré syndrome, patient may come as encephalitis, patient may come as transverse myelitis, patient may come as renal failure, or patient may come into the this ophthalmology department by the retinal hemorrhage, iritis, or there is a pneumonia, or there is a acute hepatic failure. So dengue need not to be panic, but complications also you should keep in mind. So our part is to maintain the proper rehydration and to give the thrombocyte, as that is platelet, as when required. And Dr. Kundu's question, it is answered.
Yes.
Thank you.
No, but if there is no platelet, can you give blood?
No, nothing, because there will be hemoconcentration, there is no anemia. And leukopenia, it is not that extent.
But if there is hemorrhage,
Hemorrhage, but it is of no use. You cannot stop it. maximum you can give anti-RH.
Doctor.
Dr. Mole, what is the full form of NS antigen?
Huh?
NS antigen.
It is one type NS antigen. I cannot, Dr. Dharma can tell it is an antigen, but I don't know what is the full form of it.
Five types. Five types of